All right, guys, I'm standing in a low-level laser light therapy treatment room, and I want to specifically talk about how laser therapy is helpful after your hair transplant. Whether it's multi-unit hair grafting or artist robotic FUE, laser hair therapy has extreme benefits in expediting regrowth of transplanted hair, but also helping your existing hair. If I go back to when I had my procedure back in 2005, and I've had one transplant over that period of time, laser hair therapy for the first 4 to 6 months after my procedure played a really big part in, I think, giving me the best overall global approach. So the best long-term approach with hair restoration is keeping what you've got and putting back what you've lost. So when it comes to keeping what you've got, there's lots of different modalities, and not everybody does everything, right? But the more you can do, the better off you are. And there's a specific niche that low-level laser light therapy really plays after a hair transplant. If we think about laser therapy, this is a cool laser. So it's medically proven to help with hair follicles, rejuvenating follicles that are still active, but also creating the best possible growing environment. It was originally used to heal scar tissue, and they found that was stimulating follicles. So specifically to hair restoration after your procedure, it can help the new hair grow faster, helps your existing hair grow faster and stronger. And we find that patients doing laser hair therapy are being expedited in the whole process. And the great thing about this particular device, which is the gold standard for laser therapy, is it can be done immediately post-transplant. So we can get you in here the day after your procedure, and you could technically do one of these every other day. We specifically recommend treatments with this device 1 or 2 times a week over the first 4 to 6 months post-procedure. Now, if you can't get in all the time, or you are going to miss a few weeks here and there, we can make a hybrid plan for you where you're using one of the at-home devices, where you can kind of combine the two of them, use the at-home device if you can't get in here. For me, I was pretty consistent over that 4 to 6 months, 1 to 2 times a week. Each treatment is a half an hour. You can sit under here and use a device. You can work on the laptop. So it's non-invasive in that regard. We are open 6 days a week, right? So if you can't get in and do these treatments, then the at-home devices are great. The good thing about these is they work really well with the other medically proven modalities post-hair transplant. The key, though, is what works with your routine, your schedule. We can work something out regarding that. But if you want the gold standard, FDA approved, commercial grade, low-level laser light treatments, this is the best of the best.